Hi, I'm Dr. Salil Khandwala, and I'm the medical director at Advanced Urogynecology of Michigan. I'm also a certified yoga teacher, and we offer yoga therapy for our patients with pelvic floor dysfunction. As you well know, yoga is a very, very common word now. Most people say that they practice yoga. But what exactly is yoga, and what does the practice of yoga truly entail? So let me take you down the pathway right from its inception and the beginnings to where it is today. So as you can see, several thousands of years BC, yoga was started. And the way it began is that in the Upanishads, which were the treaties, it was stated that, you have to figure out ways to quiet the mind. And that is really very important to have control on our furtive mind. But what did that mean? How do you do that? What are the mechanisms and what are the techniques of doing it? So Sage Patanjali was very concerned and he wanted to figure this out. So he traveled the globe and eventually he came up with what is called the Yoga Sutras or the aphorisms, which are very succinct definitions of how to do this. So they give us, through this 196 sutras, we have now techniques of how to quiet the mind. So yoga has been defined in several ways, but mainly yoga is the Sanskrit word for yuj, or a union of the body, mind, and the spirit. Also, it is quieting the furtive and anxious mind and be able to sit still quietly without thinking and having the mind wandering and wandering. So the understanding of the power of sitting still is very important. So this takes you well beyond what is typically done today in the exercise rooms, the yoga poses. It also talks about one-pointedness or ekagrata, and so that's a focus, and non-attachment or vairagya. So vairagya is basically, it's not detachment. That means non-attachment is where you haven't even attached. It's also a practice of discipline, abhyasa, focused discipline of doing something, and obviously eating healthy, sleeping well, and staying in shape. So all this sort of defines yoga. What yoga is not? It's not a physical workout only. It's not a cult. It's not a religion. It's not a competition, such as who can hold a pose longer, who can be in a headstand for a longer time, and can someone touch her toes or put the hands completely flat on the floor when bending forward. That's not yoga. It's about getting your body in, and nor is it about getting your body into some contorted pose. Yoga is not magic and is not practiced only by women. And it's not about wearing fancy outfits. A lot of companies are taking advantage of this and coming up with newer and newer yoga clothes, but this is all not yoga. This is the furtive mind. This is what our sadly, regular mind looks like. Very furtive, very anxious, lot of turbulences. But what we need to do and what yoga focuses on doing is make it still, completely quiet like this. That is the true focus of yoga. And that it tries to do in this Ashtanga series. Ashta stands for eight. So these eight limbs, which are some of the moral restraints, observances, or duties called yama and niyama. Asanas is what we are very familiar with, which are the posture practice, the poses. Pranayama, the most important part of this outside yoga, which is called breathing and focusing on the prana, which is the life force. Pratyahara is self-withdrawal or sense withdrawal and the turning inwards. And then you have dharana, which is focused attention, dhyana, which is meditating, and samadhi, which is the ultimate goal of yoga. So it has the outer limb, which is made up of the yamas, the niyamas, the asanas, the pranayama, and the pratyahara. But mainly what we focus all the time is just on the posture practice. The inner limb is very important, and that's very hard to get to. But once you've done the outer limb practice, then you're slowly moving on to dharana, dhyana, and the ultimate goal of peacefulness and being one with the divinity. and whatever you consider that. The first limb of Ashtanga Yoga is the yama, or the moral vows. And these are the vows. Essentially, it's ahimsa, which is non-violence. Satya is to speak the truth. Asteya is non-stealing, whether it's a material thing or whether it's an idea. So it could be true property or could be intellectual property. Brahmacharya is chastity, and aparigraha is non-covetedness. I don't want to keep looking at material pleasures. Niyama are the second limb, which is the duties, and it starts with saucha, which is cleanliness. Santosha is contentment. Tapas is fire, focus, or discipline. Swadhyaya is self-analysis. And finally, Ishvara Pranidhana, which is surrender to the divine will of God or whatever you may consider as a supreme controller. The third limb is what is really all that is done today in most places, what they call yoga, which is posture practice. But that's just one limb of yoga, the asanas. So this is the most critical part of the asana practice, which is called Surya Namaskar, or sun salutation. And it goes through a 12 pose practice. And if one kept doing this, that may be all you may need to do from the point of physical movement. But then there are a lot of posture practices, whether they're doing standing, bending, on hands, or in inversion, like in this case, or in balance mode, or on the belly, or on the back. So there are different ways of doing the posture practices, and there are hundreds and hundreds of asanas. But one of the most important limbs of this Ashtanga Yoga is the fourth limb, or the Pranayama. And this is very much discounted. Everybody talks about asanas and the postures and the poses, but nobody really focuses on the breath, and that's really important. Prana is the vital force. Yama is controlling this, and the yogic acts that help control the breathing help pranayama. So what it does is by controlling the breathing, it controls the autonomic nervous system through breathing, and the parasympathetic dominance happens. Normally, when you're agitated, there's a lot of sympathetic activity. With parasympathetic dominance, you quiet this down, relax yourself. So slowing the breathing to slow the mind is the main goal of pranayama. It improves the energy by balancing what's called the energy channels, or the nadis, and it improves the vital capacity of the lungs by making you breathe better and decreasing what's called the dead space. Dead space is a part of the lung where there is no air exchange. So there are different techniques, so many different techniques. First, you sit in a proper pose, then you're sitting upright. The main thing is to sit straight. However you sit, whatever pose you may choose, but from the tailbone to the head, you're sitting straight upright. That's one. And then there are different poses where it is alternate nostril breathing, or this is called Brahmari Pranayama or Shitali Pranayama. There are different things that can be done to help with this pranayama techniques. One important thing that we start right away is something called Ujjayi Pranayama, or victorious breathing, also called ocean breath. So it's controlled inhalation and exhalation, and that results in better air exchange and decrease the dead space, as I mentioned. Remember, what happens in this case is, let me show you the next slide. So this is how the vocal cords are. They open. So you're looking at the larynx, or the airway, and this is how the air enters in from here into the two air tubes called the trachea, and then into the bronchus, and then the lungs. So when it's going in from the larynx, or the windpipe, you have the vocal cords that generate the sound and the epiglottis. By narrowing the vocal cords down, you can then create this hissing sound, and that's this Ujjayi breathing, which is like this. So it's controlled breath, and by improving this deep inhalation and deep exhalation, it therefore, and by narrowing the windpipe, it increases the airflow transmission, and therefore it has lower dead space. So Ujjayi sounds like, anchors our attention to the breath, because now we are focusing on the breath. That's very important. Even when we are flowing and doing our posture practice, it's very important to make sure that you're breathing correctly. And this Ujjayi breathing is really important in anchoring this flow practice. So it improves aerobic exercise and prevents anaerobic. Anaerobic is lack of oxygen. Because the moment you go anaerobic, there's a high chance of discomfort, and also your breath becomes choppy and you start getting aches and pains. And it also stabilizes the autonomic nervous system. So there are many benefits of this slow, deep inhalation and deep exhalation. And that's how I showed you. So when the air goes in, it goes in from this, and then you narrow this area up here by bringing the epiglottis down, the vocal cords together. So therefore, the air exchange gets better. And then the lungs are essentially broken up into 3 zones. One lung has 2 parts, other has 3 parts, but we call it 3 zones, which is the diaphragmatic, that's here. This is the lower part, the middle part, and the upper part. So as you can see, the first breathing is when you push your belly out, the diaphragm goes down. And when the diaphragm goes down, the lung expands vertically up and down. Then when you start opening your chest, the thorax opens up. That's when the chest wall inflates, and that's called thoracic breathing. And then you raise your neck up, and that's what lifts the upper part of the neck. The most of the breathing happens through the diaphragmatic breathing, then the thoracic, and then the clavicular. So there are 3 types. So when you use what's called Purna Pranayama, that means complete pranayama, you're using your entire lung. You're using the belly, you're using the chest, and you're using the neck. So pranayama has 4 phases. One is the phase of inhalation, where you breathe in, then you hold your breath for a few seconds, then you exhale, and then you hold your breath for a few seconds. So it's 4 steps to that. And this ratio changes. In this, it all looks the same, but then it changes as we get more advanced. Your inhalation is 1 time, then this is maybe 1 time, this could be 2 times, and this could be 1 time. So that ratio keeps changing and the order changes. So as you get better and better, you're able to retain more. So inhale more, hold longer, exhale longer, and then hold out longer. Once pranayama is done, then you go to this meditation part. So when we teach our class, we go through the phases of educating about not only dietary things, but also about the flow practice. And then we talk about breathing practice. And finally, we do meditation. And that's in forms of 3 types. One is isometric, which is where the muscles remain of the same length, and then they tighten up. Quick relaxation is just slowly watching the abdominal breathing. And deep relaxation, which is also very important, many times called yoga nidra. And that's a guided relaxation where the teacher guides you through different parts of relaxation. Remember, the key thing about this is not falling asleep. Now here you're laying down in what's called a corpse pose or shavasana, but you're not asleep. That's a big, big difference. So we want you to stay awake, but relaxed. No bodily movement, sensory awareness. You're listening to what the teacher is saying, but you are relaxing and relaxing deeper into it. The goal is not to fall asleep. First you create a resolve, what's called sankalpa. So you'd say, okay, whatever resolve you may have, I don't want to eat fast food, or I want to lose weight, or I want to stop drinking caffeine. Whatever may be the resolve, you repeat it first and hold it. And then the teacher guides you through a rotation of consciousness by having you relax different parts of the body, then help you relax different bigger parts of the body, such as the neck, chest, and onwards. Then focusing on breathing, seeing how your belly breathes and your chest breathes. And finally, the teacher will ask you to imagine a few images, such as a snow-peaked mountain, or a sunset and birds flying across there, or a boat on a river. So something similar. And that basically helps you with this sensation called yoga nidra and helps you relax. So this is the typical thing. So remember, what I just told you is that yoga is not only about exercise. In fact, it is not an exercise. Yoga is, yes, the asanas or the movement is important, but did you know that an advanced yogi is one who does not even need to do that physical exercises because he is already been past it. His main goal is that he can sit still now, and his main goal is to see how much can he quiet his mind down. That's his main focus. You and I, we are novices at this, so we have to do a little bit of posture practice and move around so that we can now prepare our bodies to sit still. Finally, we go to this meditation stage, which is very important and that helps you calm down even further. And especially when people are anxious, when the problem is this, when distractions go away and night falls, guess what happens? There's nobody calling you, then your mind starts calling you and it starts ruminating and thoughts come in and thoughts come in and they just don't go away. So when you do the meditative yoga, it helps you calm down, relax, and that's what helps you fall asleep. So we are using yoga therapy studies in the two fields. One is this bladder pain syndrome and overactive bladder. You should refer to my educational seminars on these two topics, but let me quickly do an overview of bladder pain syndrome and what it does. So yoga helps with controlling the C fibers, which are the pain-producing fibers, and the goal is to produce less urgency, less frequency, less pain, and it reverses things. So for example, if I have pain, my breath is going to become choppy. What yoga does is by working through the breathing, it helps me relax more and therefore relax my pelvic nerves. It also helps in strengthening the pelvic floor if there is weakness of the pelvic floor. So that's the imbalance of the C fibers, and that's what we showed about inflammatory reaction because of the damage to the lining of the bladder, and that all can be controlled and helped with modulation of the nerves. So rather than be on a medication, we could start yoga and see how it helps in this pathophysiology. From the overactive bladder standpoint, it's the gotta go problem. So before I can make it, I'm going to be starting to leak. So guess what happens? Obviously, my anxiety level is sky high. So the thing is, how about if we control the mind that decreases the frequency and urgency and strengthen the pelvic floor muscles, and that helps relax the bladder. So it's a two-phased mechanism, mind control and pelvic floor control. So remember, what happens when the bladder sends the stimulus? It goes to the brain, and the brain, the frontal lobe, can usually say, nope, don't go. But unfortunately, if the brain control is diminished or this arc becomes very strong, then when the urge goes and says, hey, guy, gotta go, before the brain can send a signal and say, don't go, it's already completed. And person has had urgency and gotta go, and then urine just comes out. What yoga does is, remember this reflex arc again, this is the muscle around the urethra. Yoga helps you with the pelvic floor strengthen the muscles, and by strengthening the pelvic floor muscles, it does a reverse effect. It stops and relaxes the bladder. It also prevents this stimulus from being more recognized. So when the bladder is sending a signal to say, hey, I've got to go, the brain is calming down. It's not anxious, so it'll prevent this signal from being completed and the bladder from contracting. So that's how yoga works for this. So both these studies are done at our office. They are, if you're part of a study that you're doing it, then it's an IRB, which is an Institutional Review Board approved clinical study. It is done by me and my team. You will be coming to the office once a week, and that's the guided visit. And then 4 times a week, you will watch my video and you'll do a lead and follow technique. So watch me and then you'll follow me. When you do it at home, you just have to call the office and tell them that, yes, you did it, so we can keep a feedback and make sure that you've done it. And you will be provided questionnaires before and 3 and 6 months after that to see how the progress has been. Please remember, the most important thing part of this yoga therapy is consistency. Like any activity in life, whatever you choose, whether it's a vocation, whether it's an activity, if there is no consistency and a proper, reliable follow through, it's not going to work. Same thing with this. It's a simple flow. Remember, these are not complicated extortionist postures that we are doing. We're doing something simple, and that is what's going to help you. Yeah, you have to sit down on the mat because most of the exercise we're doing today and most of the meditative things are on the mat on the floor, but eventually we may start also what is called chair yoga. It's a self-practice that you do at home is as important as what you do in the office, and what you need to bring to the office is a yoga mat, a small towel, and a water bottle. Please come prepared 10 minutes before the start of session so we can start promptly, and the teacher will then guide you during your live session at the office. And please ask any questions that you may have or any clarifications you seek about a pose or about meditation or about breathing. So all in all, yoga is much, much more than just the poses. Unfortunately, in today's modern day yoga has been relegated to something like a exercise with showmanship, and where people are wearing the best dresses and putting on makeup, or the guys coming up in their best outfits, and they are trying to show off the hardest and the most difficult poses, whether it is handstand or one-handed handstand. But really, that's not it. Because I often hear people say that when they come out from a yoga class, they're more disturbed because they feel that, oh, today I could not hold a pose. Today I could not do what like she could do or he could do. And they're competing. And that's not the purpose of yoga. So that's exactly the antithesis of yoga. Yoga is mainly aimed at doing things that can help you focus and concentrate so that ultimately you can quiet the mind down, forget the physical body, and sit in a tranquil state. And that is what we use in our therapy. And we will see how it evolves and what our papers show. But there is tremendous promise that has already been seen in different patients in different yoga therapy studies. So I'm sure that even though not much has been done with the pelvic floor, that our studies also will help somehow, somewhere. Time will tell us where and how. Thank you.